All right, we are live. Oh my gosh, you guys. Hey, welcome, welcome, welcome. I am so excited. I am Dr. Angela, your favorite America's transformational weight loss expert. I'm waiting just a few minutes just to let everybody join in, but I'm so excited. I hope everybody is having a great start to the new year. It's January. It's the new year, new you time. But as your medical weight loss expert, it is time to put your resolutions aside. Actually, put science to your resolutions and get predictable results. I've got a lot of people that I invited here. If you know me, please comment below. Please say hi. And if you are a current member, one of the most important resolutions that I made this year was you need to celebrate yourself. I think a lot of the times we end up not giving ourselves enough love and credit. So, in case you're a current member, even a past member, share your success stories. How much weight have you lost? How much are you on your way to your health goals? And let's just give everybody a shout out as we start, this January and 2023 and just really get your health in order, which is very important. I'm so excited to have this topic just in case you guys haven't been paying attention to TikTok, the news, Hollywood. There are some medications out there that are making a big buzz. And so I wanted to sort of kind of hop on and give you guys behind the curtain scene. Okay, as you know, when you see things on social media and you see things on the news, hey, guess what? They control the narrative. They're going to share with you what they want to share with you. Okay, but hey, guess what? They're not going to share with you the stuff that they don't want to share with you. So I want to give you the nitty gritty. I have my team members here, Ashley and Teresa. So please give us some likes and hearts and shout outs. They're helping us out. I am aware that there are lots and lots of questions out there. I am going to address some of the ones that I have come across. But in case there isn't anything that I address, please comment below. My team members are going to try to tag me and I'll try to answer as we go. And just to give you a heads up, this will be recorded. So in case you didn't catch it live or you have to leave for a meeting, we'll send you the replay, whatnot. But today I want you guys to have fun. There's nothing formal. This is not a lecture. This is not a science, Bueller talk. This is really hanging out with Dr. Tran at home in my own living room on a snow day. So excited to be here. So I want to welcome, for those of you guys who don't know me, just to let you know, I've been doing this for over 10 years. So I did turn 45 last year, so I am older than what I look. But anyways, I do want you guys to recognize that, I started out as an internal medicine doctor. I worked for, an outpatient clinic. But just to give you, some insight, I didn't really feel like I was being the right kind of doctor that I wanted to be. And long story short, I fast forward to just no longer writing, prescription after prescription and just really contributing to the problems of healthcare. I said I wanted to prevent it. So I went ahead and I specialized. I did additional training in obesity medicine. So just to let you know, I'm actually one of the very few in Colorado or even actually nationwide where I'm double board certified in both internal medicine and obesity medicine. Okay. Why do you guys need to know that? Hey, guess what? You're not going to tell me anything that I haven't heard before. Do you have, a thyroid problem? Do you have rheumatoid arthritis? I spoke with a patient this morning that had ulcerative colitis. I know all of these diseases. And hey, guess what? They're all interrelated somehow. And you need a doctor who understands how your body works. But hey, guess what? That's why you're here. Now just to kind of let you guys know, if you're new, you guys are probably guessing or telling Dr. Tran, okay, just like the conversation I had this morning, Dr. Tran, I eat healthy. I mean, I make good choices. I'm exercising 3, 4, 5 times a week. Yes, I'm older. I'm in my 40s. I've had a couple kids. I work full time. I'm busy. Yeah, I've got a lot of stress. My sleep's not great. but I've been working my butt off and what gives, right? So, let me know if you're if you're feeling that that's you in the comments below, because this is I'm going to actually pause and say a very bold statement to really kick off this topic that we're about to enter. Your weight problem actually is not your fault. Okay, so now I'm going to explain myself. Okay, so hey, guess what? When I start working with patients, I always call myself as the mechanic for the body. Okay, guess what? I always tell patients, look, you're a safe driver. You look left and right. You put on your seatbelt. You go the speed limit. Why in the heck is your car not going on the highway? And I always tell the patients, hey, guess what? You're not going anywhere until you fix the smoke that's coming out of your car. Okay, that's why this topic is important. That's why you're hanging out with me, because, hey, guess what? When we alleviate the metabolic barrier, obesity is a disease. Okay, it's beyond this lifestyle choice, right? And so when we can identify what are the underlying things that actually is keeping you from losing weight, that's why these medications are coming out. That's why you need to know. No, you don't have to be on these medications, but these are like tools. This is like my screwdriver, my wrench. This is to fix the engine. And guess what? When it gets fixed, diet and exercise becomes easy. Okay, so all right, so I'm going to jump right in. Yes, I'm going to let you know. Like I said, if you haven't been paying attention, literally 2 nights ago, these medications were on NBC Nightly News. I believe Kim Kardashian has mentioned it. Mindy Kaling is another Hollywood actress. This has been involved. Apparently, maybe Elon Musk, whether you love him or you hate him, type of thing. And it's all over TikTok. What the heck are these medications? You might have heard of, the phrase like GLP-1 agonists or semaglutide, some of the brand name medications that you've seen, that I'm going to mention: Wegovy, Ozempic, and Mounjaro. Those are sort of kind of the top three medications right now. So let's just kind of dive in. So, like I said, I've been doing this for over 10 years to date. You guys know that science and research for a million years of weight loss, they have come out with so many different medications out there. You might have heard of, like, phentermine is one of the older medications. That's something that we still classically use. You might have heard of Qsymia, some of the other ones like Contrave. You might even heard of a medication called Belviq. Hey, guess what? Belviq got taken off the market because it wasn't working and it was causing problems. Okay. Fast forward to today, these three medications that we're going to talk about came out in the last year. The rumor is true. It does work. And I don't want to over exaggerate, but I've had at least 3 patients who've lost over 100 pounds, all female. Okay. All varying different, like, ages, medical history, backgrounds, things like that, but all smoothly, right, consistently over 100 pounds down. But this is where we come in. I'm going to share with you the fine print of what you need to know. Okay. So let's talk about these medications. Okay. What the heck do they do? As we've done research on obesity, what's going on is that one of the root causes that we know, guess what? It doesn't matter whether you eat too much or eat too little. I would actually argue that a lot of the people that are watching today, but probably are sitting there and they're like, your significant others say, hey, you hardly even eat. Why do you have a weight problem? And then you're like, yeah, of course. Yeah, I do have a weight problem, but I don't eat, that much. So what gives? So what's going on is, what is the problem with your weight if you don't eat much? Okay. Insulin resistance, just to kind of give you a fancy term out there, you guys might have heard of before, is one of the root, if not top rooted problems when it comes to weight problems despite eating. Okay, so let's talk about insulin resistance. What the heck is it? In simple terms, just to let you know, insulin is a hormone that you make that is supposed to metabolize all of that sugar into energy. Okay. But what happens is that with insulin resistance, insulin is starting to get lazy. Okay. And all of a sudden, instead of turning that sugar into energy, it turns it into the form of body fat storage instead. Okay, so again, that's sort of why, if you're hardly eating, why did you blink and you gain 5 pounds? Again, everything is going to storage. Some other features of insulin resistance. Typically, some of our patients primarily tend to crave more sweets and carbs. Now, don't forget, breads and pastas are still on the kind of the carbs and sweet side of things. So those are the typical cravings. Although, if you are an individual who like works 16 hours a day, doesn't sleep, super stressed out, you are going to knock yourself into the salty and savory side of things. Why? Because then you are actually leaning on a different hormone called cortisol, which is a totally another topic. Okay. There are some women who, whether it was diagnosed in your teens or even in your early 20s or even now in your 30s and 40s, if you have a condition called polycystic ovarian syndrome, guess what? You have insulin resistance. Okay. No wonder you have trouble losing weight. In fact, unfortunately, with PCOS, you might actually have trouble getting pregnant. It's a hormone problem. If you have a family history, I have family who have diabetes all along the side, all along my mother's side. So I'm very cognizant about that. In fact, when I had my daughter Haley 8 years ago, I was diagnosed with borderline gestational diabetes, insulin resistance right there. Okay, so those are the things that you want to sort of kind of look for. Like, okay, well, insulin resistance. So where do these medications come in? So these medications, so just to let you know, Wegovy came out just a little over a year ago. Okay, it does what we call turns your insulin into a super insulin. Okay, so rather than putting all of that sugar into storage like it is right now, Wegovy, I almost call it a sniper for your insulin. It really shifts that pendulum chemistry to get you to regulate your sugars, metabolize. The cool part about it is that it's not only working on your stomach gut system, where it controls your appetite, makes you feel full sooner. It raises your metabolism. So, yes, in fact, not only is it controlling your appetite, but you are burning calories more efficiently. They also recognize that it has some brain chemistry effects where it really helps you to like behaviorally, almost, I hate to use this phrase, but sort of feel like a normal person, right? Where you just are able to eat, whether it's a healthy or maybe not so healthy choice, you just are able to comfortably have a normal meal, stop when you feel full. And hey, guess what? Whether whether I used to work in the medical clinic, right? Guess what? Every day was National Donut Day, or it was potluck, or a birthday, someone leaving, someone coming. I mean, I just had to have a hockey stick and check everybody away, from all that food. This medication doesn't even make you flinch when someone walks across you, with donuts. Now, I have not personally taken the medication, but I do have family members that have. So I know firsthand how they feel, and it's phenomenal. Okay. Just to give you some insight, Ozempic is another medication. You probably have seen it on TV. Everybody, the song, oh, 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 Ozempic. The stupid song that just gets in your head, type of thing. Just to give you some insight, Ozempic is the exact same medication as Wegovy. Hands down, same medication, okay? But they're just made by two different companies, and Ozempic is actually branded for diabetic patients. Wegovy is still the one and standing FDA approved medication for weight loss, just to let you know, okay? The third person, the third musketeer is Mounjaro. Mounjaro came out in May. Just to let you know, Mounjaro has a little bit of an added effect. When it came to head-to-head trial comparison with Wegovy and Ozempic, I mean, we were amazed that Wegovy and Ozempic here. Just to give you some stats, is producing like 15 to 20% weight loss. I mean, that's like 30, 40 pounds of weight loss, just like that. And just to let you know, some of the older medications are more like 5, 10%. That's why it's making such buzz, is because this actually works. And you're like, holy crap, this actually is effective. Mounjaro came out in May, walking into town, over 20% weight loss. Okay, so again, that's over 50 pounds for those certain individuals. And just to let you know, there's still another one in the pipeline. I literally learned about it, last week. Probably won't come out in 2023, maybe 2024, but it's supposed to be even better. And didn't even know if that was even possible. Okay, so just to kind of give you guys ideas on what you are kind of looking at. Okay, but let's stop for a second. Let's really dive into sort of kind of the questions of, okay, so all right, Dr. Tran, you got my full attention. These medications work. You've got 3 patients that lost over 100 pounds. Where is the catch? Okay, so a couple of things. Number one, these medications, at least from my standpoint, I can only prescribe it if your insurance covers it. Okay, so if you do anything after this, you guys just contact your insurance to see if it's covered. Okay, so unfortunately, because they're newer and they're really complex, the going out of pocket cost is roughly like 1,200 to 1,500 a month. I promise you, even though it seems like, wow, this is a magical medication, it's not worth it. I would rather buy a Louis Vuitton purse, just to let you guys know. I think you guys will enjoy it much better. I promise. I'll help you lose weight in another way without medication. So just to let you know, please, just the understanding. I've had a lot of patients who literally have come to me and say, I'm willing to pay out of pocket. And I'm like, it's actually not worth that big of a cost. But if you are one of the lucky few, and I say lucky few is because right now insurances are really doing the crackdown on who gets it. Okay, just to let you know, Ozempic and Mounjaro right now, majority of insurances are excluding it only to patients who have diabetes. Okay. Now, if you do happen to have a really good plan, some insurances actually don't care, and I can order it, no problem, type of thing. But just to let you know, Ozempic, Mounjaro right now can only be prescribed if you're diabetic. Mounjaro will be FDA approved for weight loss, ideally later this year, hopefully in the spring, early summer. Okay, so, but Wegovy is for weight loss. That is something that can be prescribed as long as your insurance is covered. Okay, so that's step number one. Before you pass go and collect $200, that's the first thing that you want to do. For those of you who are current members, we can switch you over. Okay, but again, I do need to know that information, just because gosh, it's been quite a fight with insurance and prior authorizations and things like that. I do everything possible, but as you can tell, insurances have a very specific criteria, and they'll either approve you or they don't. It's very black and white oftentimes. Okay, so that's number one. But let us know if you're a current member. Totally switch you over if you have, if you won the lottery ticket. Okay. The second thing that you do need to know is that these medications come in weekly injections. Okay. Now you're gonna laugh at me. I'm not a needle person. Like I can totally perform surgery. I can give other people shots and things like that. But I've passed out before when somebody gives me a shot, type of thing. I'm not a needles thing, but it is small. You get it at the pharmacy. They come in pen needles, and you do it at home. So super easy. Luckily, it's only once a week, so no big deal. Okay. There is one option that comes in a pill called Ribelsius. Okay. Just to let you know, it just doesn't work as well. I don't order it. People have a harder time tolerating the side effects. So just want to give you a heads up. Technically, there is a pill form if you are truly not into injections, but the injections do work much better. Okay.
Dr. Tran,
Yep.
can you just answer one question that came in really quick? And this might be this, I would imagine this is something that you would get to. Someone asked the question, Terry asked the question, if any of these that you're talking about are safe for heart patients.
Oh, Terry, I love that question. Thank you so much for bringing that out. Here's the cool answer. Absolutely yes. Okay, so for all of you guys know that some of the older medications in the past, 20 years, do help with weight loss, but there are cautionaries when it comes to watching your blood pressure, your heart rate. They are considered stimulants. So some of the patients just can't handle it. It almost makes them feel like they drank like 20 cups of coffee and it just caused palpitations. And obviously, that's not safe. The cool thing about these medications, they have zero effect on your heart. So yes, you would be a good candidate if you had, you know, um, significant heart problems in the past, or just high blood pressure that's just hard to control, or anything heart related. The cool part is that you are a candidate. So great question. I'm glad you brought that up. Um, the second thing is that probably leads me to the next question. Who would I even prescribe it to? I think that's a good question. Just to let you know, um, as a medical weight loss specialist, sure, there are specific criteria when it comes to your medical history and your lab work, the whole clinical picture, right? I will get you blood tests. We'll take a look and see if you have diabetes, or if you have family history of diabetes, if you have symptoms that relate to insulin resistance. So, as you know, you do need to talk to either me or your primary care doctor if you're a good candidate. Now, do you have to have diabetes to have this medication? No. 100% no. Okay. Despite what they're saying out there, they're following FDA regulations. Ozempic and Mounjaro is again for diabetes, but Wegovy is for weight loss. Okay. I have plenty of patients who do not have diabetes, that do not require that diagnosis, but they have features of insulin resistance, which is where I come in. Okay. Another question that people ask is that if I don't have diabetes, what happens is that if I take this medication that helps with insulin, is my sugar going to drop to a low level? Okay, and that's a great question. That's why it's medically monitored. For the most part, these medications are regulated in doses. So if I ordered it for you, it's going to be a very low dose. You're going to be doing that low dose for a good month, and then we make increments as we go. I've had patients who've had picture perfect blood sugars on these medications and have zero problems with blood sugar. However, having said that, that is something that we monitor. But these medications start out at a really low dose for a very good reason, to make sure that you're safely on it. Okay. Um, the next question is that, so if I don't have insulin resistance, can I still be a candidate? Yes. Again, this is a weight loss medication. As you know, you guys, I'm going to kind of take one moment to step aside and say, you might have heard that there's sort of kind of this battle between, like, well, we should reserve these medications for diabetics. There are some people who just say, um, they're giving this false conception that obese patients, quote, don't deserve access, and that's bullcrap, as you guys know. These medications that you're seeing in the market, you'd be amazed how many years of research and clinical trials and FDA approval process. I mean, I don't know exactly, but I bet Wegovy was started back like over 10 years ago. Okay, so this is not new. It's just new to us because it finally got approved. Okay, but just to let you guys know, there is a correlation between obesity and diabetes. Okay. And then there's a separation. You can be a diabetic and be a normal weight. You can be an obese patient and have no diabetes, but then you can also have both. Okay. So just to let you know, again, you do not have to have diabetes, and turn your head away from those who just feel like this is a diabetes patient, you shouldn't be taking it. I am an advocate for my patients. Obesity is just as an important of a disease, just as much as diabetes. Why should we favor diabetic patients? In fact, my patients who struggle with weight are very motivated. Okay, so that's another question. Terry, you got another good question. I'm kind of seeing here. Do you have to take this forever? That's a great question. No, follow small fine print. Okay, so here this is a good segue into the next portion of the kind of the Q&A. Okay, I just want to let you guys know, as much as these results and statistics are amazing and magical and fairy godmother worth, right? You always have to complement it with the right diet and exercise to make it work. Just like kind of like how I explained it, these are training wheels. If you never learn to ride the bike in the first place, yeah, you're going to be on training wheels for the rest of your life. However, that's why you guys need to hang with us so that we can teach you the right diet and exercise habits so that we help you get to your goal. You're on it long term or short term. You can be on the medication for a few months. Some people actually do so well that they're okay being on long term, even a year or 2 years or whatnot. But just to let you know, when it comes to maintenance, you absolutely have to have the right diet and exercise plan to complement it, to resolve insulin resistance, and really understand the healthy habits to keep you home free so that you no longer have to be on it. Okay. I say that very importantly because you guys, when you guys go back on the internet, I'm sure you guys are going to go back on, you're going to be calling your insurance, you're going to be looking up Wegovy, Ozempic, Munjaro. You're going to be exposed to ads up the yin yang. I'm giving you a heads up. Okay. $99. Just come on in. It'll be 10 minutes and we can get you, this medication right from our very clinic. And you can lose 30 pounds in 2 days. That's what you're going to see. Okay. I want to give you guys a word of caution. And, I appreciate, I'm not here to compete. Anybody who helps patients with weight loss, they are like my best friends. Okay. But I want to give you a fair warning. There are probably a ton of clinics now that claim and provide these generic versions of these medications. They come in the form of called semaglutide. You literally walk into the clinic, they give it right to you, and or I even heard that they'll like even deliver it to your home. Just to give you a word of caution, these clinics are getting it from compounded pharmacies. Who knows which pharmacies? There is not enough regulation of these compounded pharmacies. So you might be getting copycat versions. Now, don't get me wrong, some work, but some don't. But I'll let you know if you're taking something from a clinic and it's not from a pharmacy, it's not regulated. So I just want a word of caution. I know that people, feel desperate, but they can't pay out of pocket. I just encourage you to just steer away from just the they're there to just kind of get your money, and these medications are not like supplements. This is not something that you should like just freely get. And then going back to Terry's question, am I able to keep it off? Hey, guess what, most of these clinics just kind of give you the medication, take your money, and see you later. That's why it's so important, is because yeah, you don't want to be on this medication forever. You don't want that clock to strike midnight. That's why we have an entire team of registered dietitians, health coaches, fitness trainers, so that yeah, you can ride the bike on your own, happy go lucky free, so that you can finally understand that we fixed the metabolic barrier, so that you can understand, oh, okay, now food is the new prescription of choice. Okay. Um, let's talk about the side effects. Okay, and my team can kind of keep popping in the. I've seen a lot of questions, so I'll make sure that I address as many as I can. But I talked about the complexity. Okay, the side effects of these medications are going to be primarily gastrointestinal. Okay, so we want to watch out for mild nausea, diarrhea, stomach upset type of things. Just to let you know, I've been prescribing these medications for at least a year now, so I have just like hundreds of patients that already gone through, and their primary report of the side effects is that they may notice mild nausea. They say it's not that big of a deal, but it is noticeable. But they say it tends to help with the appetite suppression. So I've had some women who say the nausea sort of feels like a little bit of that mild nausea that you feel when you're pregnant, kind of thing. I really haven't had anybody who've had major stomach problems, but just to let you know that, those are the things that we want to take word of caution. So those are kind of more of the simple side effects, but most patients tolerate it. But that's also why we start at a very low dose. We do that for 4 weeks and then increase as you go. Okay. But let's talk about the reason why you want to go to a medical weight loss specialist and not some random doctor who's going to give you the medication. Okay. There are some dangerous side effects that we do need to monitor. Okay. Some of the more serious, low risk, but more serious side effects are inflammation of your pancreas. People might be familiar with the word acute pancreatitis. Okay. It's not good. It's not fun, but it can irritate your pancreas because pancreas is the organ that produces your insulin. Okay. So that's just something that we will want to monitor. It can affect your gallbladder. If you have gallbladder problems or if you have pre existing gallstones, something to think about. Okay. Um, very, very rare, but I'm in a variety of different Facebook groups. I did see not my patient, but someone who did have a problem with her kidney while taking it. So she ended up having to see a kidney specialist. Everything went well as soon as she stopped the medication, but that is a serious thing that you need to watch for. And then last but not least, this is very important. Of the medications, it doesn't matter whether it's Wegovy, Ozempic, or Mounjaro, when they did clinical trials on lab mice, they did notice that some of these lab mice developed thyroid tumors, a type of cancer called medullary thyroid cancer. Okay, so those are the things that we take into caution. Okay, now just to let you know, and I've spoken with different drug representatives, I talked to pharmacists. The good news is that it is low risk, but obviously because it occurred, they do have to put that warning label. The second thing is there were 0 human cases. Okay, now so they only detected in lab mice, but because they did notice that, that is something in also the fine print. So again, just a friendly reminder, this is why it's so important to go to, again, a full-on obesity medicine specialist like myself. Okay, technically, yes, you can go to your primary care doctor and you can get a prescription, and some primary care doctors are doing great. They do monitor. The problem is that they don't have the diet and exercise plan. They probably order, that type of medication once in a blue moon because it's more of a specialist medication. And again, they don't have the right tools. They will probably tell you that you need to be on it forever, which is not true. Okay. And again, weight loss is a little bit funky. You are going to run into other doctors who are doctors doing weight loss. But if you look into like the certifications and like, what is this? This is an anesthesiologist. What the heck is he doing? Helping you lose weight. Or I love my gynecologist and they're awesome. They deal well with female hormones or whatnot. But guess which body part that they specialize in? Unrelated to weight loss. That's all I have to say. Okay, so, but they're my good friends. One of my best friends is a pediatric gynecologist. Isn't that amazing? She's like one of like 5 in the entire country. Okay, but I just want to emphasize again, don't mess with obesity. It's not just some random anybody can help. That's why I did so much extra training to really understand how this works. And I tell you, it's beyond just calories in and calories out. So I want to give you guys, just the advantage of just, hanging with me. And this is something that I'm going to be doing regularly so that you guys can just get the real insight so that you're not listening to all the influencers, the TikTokers, the Hollywooders, even the news people are guilty. They only kind of give you a superficial surface. I want to give you kind of the real deal. But it is safe. It needs to be medically monitored. It needs to be combined with a diet and exercise program. But putting it all together, it's amazing that, yeah, if you need to lose over 100 pounds, it can happen. If you need to lose less than 100 pounds, you're considered easy. Okay. So, and I love my bariatric surgeons and they're awesome. There's so many here in Colorado, but I would argue that these medications might make surgery a run for its money, for sure. So, but this is just a really, you know, great tool again, advanced medical technology to just finally get to the root, sniper that, okay, and then really fix your problem, kind of thing. Okay. Um, One side note. So I have a lot of questions when I talk to patients. They say, Dr. Tran, I like typical, the diabetes runs in their family. Their doctor maybe had a kind of had a conversation where they did, or they were close to pre-diabetes, maybe not so much there. And they say, well, I mean, I was told that intermittent fasting is supposed to work. Keto is supposed to work. What the heck? Well, why are these not working? Okay, I'm going to give you some insight around that. And I there's so many doctors that promote it, and they're all credible, highly respected. Just to let you know the difference, keto and intermittent fasting, either one, accomplish the same goal. So, yes, they treat insulin resistance, but what happens is that they're actually just lowering the amount of insulin production that your body even does, so that you're leaning on proteins and fats as your source of fuel, which is important, which is good. That's honestly the concept of low carb, right? So that you don't even have to use your own insulin very much, so that it doesn't get to trouble, so that it just metabolizes a little bit of sugar, and then it doesn't put into storage. Okay, but here is the disadvantage and the advantage of these medications. Wegovy, Ozempic, Mounjaro, it actually makes your insulin work better. Okay, so understand the difference. Keto and intermittent fasting only just make your insulin levels low, which is okay, but I mean, keto, I can't eat bacon for the rest of my life. I can barely eat it after breakfast. Um, Intermittent fasting, I'm sorry, I have to focus in the morning. I can't wait until noon to eat, no matter what. Especially if you have kids, you guys know, give me some likes on that type of thing. It works, but it's just not the lifestyle I want to live. I want to eat normally, okay? But I actually have insulin. I just want it to work better. So just want to kind of give you the subtle differences and like, oh, aha, so, not that keto and intermittent fasting will eventually die down, because I think it just will just kind of live, forever, type of thing. But just to kind of give you the sort of the another scientific insight. Oh yeah, I want my insulin to be a super insulin. You actually want it to work, and you want it to work even better, and that's the advantage of these medications. Okay. Oh, Corinne, great question. These medications are provided by the pharmacy, and they come in the form of pen needles. So Corinne asks the question, so how do you, if it's a weekly injection, how do you receive it? It is a basic prescription to the pharmacy, and they give you a box of pen needles. They'll teach you how to self-administer at home, super easy peasy. Okay. It's not like, don't want you to necessarily fear that it feels like an insulin syringe type of thing. They're actually pen needles, and they're easy to dispose. A little bit different. My dog Lucky, we say hi to Lucky. He's up in the Rainbow Bridge. He did have diabetes, and we legit had to buy syringes and insulin needles to give him insulin. And it was kind of a tiny poke. You can imagine trying to give a Maltese. He was like 10 pounds, an insulin injection. I gave him chicken, so to distract him, type of. But if I can give my dog, who literally has no idea what's going on, what the heck are you doing to me? It was a tiny needle. But that's a great question. That's a nice way to understand, because it's, you don't have to go to an office. Weekly or whatnot. It's literally a prescription. Now, just to let you know, in the beginning, because we start at a low dose, we titrate. Some people get like kind of a maintenance. Some people need higher doses, but we start out at a 30-day supply. And then just to give you guys some insight, once we get at the maintenance dose, that's when we can do more 90-day supplies. I know that there's like a kind of a cost saving on that. Um, I believe health savings and flexible spending accounts should, work towards that type of thing. But again, the most important thing is that your insurance covers these medications, which is important. And if you are just one of the people who say, I don't care, I want to pay out of pocket, no qualms, no problem. But just want to let you know, the first 4 weeks is such a low dose. Most people won't quite get the results until the second or third month. So you'll almost be out like 2,500 before you actually get to the effects, just to share with you. Now, there are savings coupons on these various websites. So there's actually a small possibility that you qualify for a short-term supply. And even though your insurance may not cover it, obviously you still have to meet certain criteria for that. Now, I used to work for Kaiser, and I just want to say that generically, working for Kaiser typically covers generic versions of medications. They're not necessarily known for brand coverage unless there's like specific criteria. So just to let you know, here in Colorado, if you have Kaiser, might be a little bit more of an obstacle to get a hold of these medications, just because Kaiser is covering more of the generic type of medication. So that's a little bit of a party pooper, but sometimes we find ways around it, type of thing. All right. What other questions do we have?
Yeah,
Else?
I was just looking back here. Heather asked a question. She said, would you be prescribed either Wegovy or phentermine? You wouldn't be prescribed both at the
Yeah,
same
very
time.
good question. Technically, there isn't any strict guidelines that you can't take both at the same time. However, I found that they just seem redundant. So, with the patients that we have right now, they're usually taking either or. And again, in my ideal world, if for some reason you started on phentermine, but you find out that your insurance does cover Wegovy, in a heartbeat, I would switch you over. Actually, just because of the physiology and how it works. Now, I don't want to put phentermine on the back burner. It's still a great medication, so don't wave the white flag. Phentermine, what I love about phentermine is, hey, guess what? It is still been around since like the 1970s.
Mm.
It's dirt cheap, and obviously all of these medications are short term. So don't feel too terrible that your insurance doesn't cover it. I've lived with it for the last 10 years. And again, we just remember, regardless of any medications that we use, they're just training wheels as we help you learn how to ride the bike. Okay, so phentermine is still a great option. It's still my go-to, particularly because these medications are just newer. It's gonna be a while before a mass insurance coverage for the entire country. However, I'll let you know, once Mounjaro hits the market as FDA approved, again, I'm feeling late spring, early summer, gangbusters. Okay, I really think that there's going to be a shift in insurance coverage, ideally, especially if yet. So the drug company is Eli Lilly. They actually have another one I mentioned in the pipeline. I'm guessing it will be ready for 2024. It's even better than Mounjaro. Like I said, literally, it could just literally just I mean, I'm just prematurely saying, but there are medications right now that are coming out with statistics of curing Alzheimer's. What I've read from these medications that are through the pipeline, I mean, they could potentially cure this obesity disease. Now, not so easy. Again, I wish it was like a magic wand, but these medications are so dang advanced. I'm just amazed at what it can do, but it has to be monitored by a medical professional. It's not something that it's not like a supplement like ephedra back in the day. It still requires just a lot of complexity, which is why I spent 15 plus years of my life getting here anyways to become a doctor. Thank goodness. Type of
All
thing.
right, we had another question, Dr. Tran. Once approved by insurance, how long do we get the weekly shots?
Oh my goodness. So, true story. I submitted a prior authorization for a patient this morning. 2 seconds, you guys. I got the approval back. I'm in this portal where I submit a prior authorization. They're like, congratulations, you're approved. I sent the prescription pending snow. She could have picked it up today. That's how fast it is. Okay. Now, word of caution, these medications are so popular in the last several months. I'm talking like 6, 8 months, because they're so popular and just so like mass prescribed. Pharmacies had been dealing with inventory and stock issues. Okay, so if we order it, you might still run into pharmacies that are on back order, but it has gotten better since the new year. Um, we've used Amazon, we've used Walgreens, King Soopers, CVS, all types. Um, so it just kind of depends on your area, but just to give you a heads up, some of them are on back order, but very easy. Pick up the pharmacy injections, and then we prescribe as we increase the dose.
Gotcha. Okay, we have another question here. Um, is there a credible resource where patients can receive new information as FDA approves on these medications versus social media / Google?
Yeah,
No.
that's a great question. Obviously, you want to visit those websites, whether it's like Mass General or the Mayo Clinic. Obviously, the FDA. The number one source, and it may seem like, huh, really, the actual drug company. So Eli Lilly is the drug company that that produces Mounjaro, which is the newer medication. Novo Nordisk is the company that produces Wegovy. So going straight to the drug. In fact, I'm have a very good relationship with the drug representatives of each company. Back in the day when I was in the office, you can imagine, just like a doctor's office, they come on in, they visit, those drug reps all the time, just like trying to get you to prescribe the medication. But nowadays, I have such a great relationship that I do get insider information, so Wall Street insider information, as far as just understanding, what does the stock inventory look like? What's the safety profile? Just to let you know, I mean, they're well aware of these clinics that are unsafely, distributing from their clinic. And I can sense a lawsuit coming. These drug companies, they don't mess around. These are like multi-billion-dollar companies type of things. So, but yeah, to answer your question, the actual drug companies will be your best. And as boring as it is, you might want to actually look at the clinical research. It is posted, and you can access the. In case you had to take statistics in college as a requirement, you get to read about p-values again, and significance and things like that. Corinne asks, how often do you need labs done? Great question. We want to start out with like the initial labs for sure. I want to get a lay of the land. Some people will require a repeat depending on the abnormal setting. Other people may not necessarily have labs, but again, it's all part of the monitoring system, during the program. But that's a great question. All right.
I think that's it, Dr.
All
Tran, as
right.
far
Well,
as
yeah, we're right on time because we've got another call in about a few minutes. So, thank you for listening to me. Sometimes I just feel like, gosh, is anybody like interested in this stuff? Because I'm such a nerd about this stuff, and I get so excited. But just a friendly reminder: I'm here to give you the real dirty truths, the positives and negatives. Okay, so let's just clean out all the noise that you guys see, and I would just appreciate you for allowing me to be so your credible resource. I do plan on doing these live Q&A and different topics on a regular basis. So this is just to kind of kick off the new year. And I'm missing patients in the office, but that's okay. I want to kind of get back into just making sure that you guys have all the information that you need. And I just want to let you know that you know I love what I do, and a lot of the times it's just understand that this problem is not your fault. It's just true medical disease. So let us medical professionals handle that for you so that you can stop blaming something that is nonsensical, and just understand that, hey, guess what? You just needed one screw that needed to be tightened, and things will be much easier. Okay, so I appreciate
Dr.
you guys.
Tran,
Yep.
one more quick question. If anybody is interested in working with you, because
Oh,
we
yeah,
have
yeah.
somebody, Marita,
Listen, I mean, that, that,
she
that.
said
Yep.
if, yeah, if you're in your
Yeah.
program already, what would be the next steps? But if they're not in your program, How can they start working with you?
Absolutely. So if you're already current member, again, for everybody, whether you're a current member or not, just really make sure if you can contact your insurance to see if it's covered. Now, if you aren't able to get that information, no problem, we can help you. But if it was a simple phone call or going into your portal, find that information. Okay. If you're a current member, super easy. Just send an email to the team at support@denverweightlossclinic.com. Okay, super easy. I mean, if you can't remember that, just ping me in a private message through Facebook or LinkedIn and whatnot. I'll take care of you as well. If you are a brand new future patient who's going to hop on today, go to our website. Go to denverweightlossclinic.com/schedule. We're offering free phone consultations literally within the first 5 minutes. We're just going to rock your world and just really identify what has truly been keeping you stuck. So you can just kind of like just really be enlightened on, wow, just beyond what you've been doing with your diet and exercise, alleviate the root problem. And then, yeah, let's get you to your goal this year. Okay. So awesome, team. Thank you so much for putting the links in. But you guys are amazing. I appreciate you guys very much. Again, feel free to, if you're a current member, pop more questions into the Dr. Transformers. You can still email the team if you just still had some more things you wanted to sort out. But hey, we're here for you. I'm here to give you the latest and greatest, and let's get you healthy this year. Okay. All right. Well, we'll see you guys later. Have a wonderful snow day.